Welcome to the deep dive. Today we're taking a closer look, really getting into the Indian healthcare system.
Yes, it's quite a complex topic.
Absolutely. And you, our listener, asked for a way to understand it, grasp the essentials quickly without feeling totally overwhelmed. So that's our goal today.
Right, and for this we've looked at quite a few sources. We've got info from healthcare consultancy Supreme Medic, the HospiMatch portal, and several texts that really lay out the structure of Indian healthcare, including AYUS.
Okay, so the mission here is clear. Pull out the key insights. How is healthcare actually set up and delivered in India? We want to highlight the structure, yes, but also the challenges and maybe some ways to think about navigating it effectively.
Sounds good.
All right, let's get started. Where do we begin? The overall model.
Yes, let's start there. Fundamentally, India operates on a mixed healthcare model.
Mixed meaning?
Meaning you have both the public sector government-run and a significant private sector delivering care. They coexist. Understanding this duality is really key to the whole picture.
Got it. Public and private working alongside each other. And within that, there's a structure, right? A tiered system.
Exactly. It's generally described as a three-tier system for healthcare delivery.
Okay, let's break that down. Tier 1.
That's your primary care. Think of it as the first point of contact. This includes things like sub-centers, primary health centers, or PHCs. You'll hear that acronym a lot. Family doctors, local clinics, polyclinics.
So the places you'd go for like a fever or a checkup, immunizations.
Precisely. Basic ailments, routine checkups, preventive services like vaccinations. They're particularly vital in rural areas, often the main source of care there.
Okay. And it's important to know when to use these, right? And maybe when not to jump straight to a big hospital.
Absolutely. Primary care is really designed for those common health issues, basic screenings, and ongoing preventive care. Using it appropriately helps the whole system function better.
Avoids overwhelming the higher levels unnecessarily.
Yes, exactly. And it's usually more accessible and affordable for those initial steps. You'd move up, escalate if your primary doctor refers you, or if the condition is clearly more serious or isn't getting better.
Makes sense. So if you do need to escalate, what's the next level? Secondary care.
That's right, secondary care. This level includes facilities like community health centers, CHCs, district hospitals, various multi-specialty centers, and also many private hospitals fall into this category.
And here you find more specialized doctors.
Yes. This is where you typically access specialists. Think gynecologists, pediatricians, orthopedics, physicians dealing with more specific internal medicine issues. Often you get here via a referral from primary care.
Okay. And then the top tier, tertiary care.
Tertiary care, yes.
Yeah.
This is the super specialty level. We're talking about major institutions, often the big names people recognize, places like AIMS, Apollo, Fortis, Medanta, for example.
And these handle the really complex cases.
Exactly. Highly complex treatments. Things like advanced cancer care, major cardiac surgeries, neurosurgery, organ transplants. Access here is usually, almost always, based on referral from the secondary level.
Okay, that three-tier structure seems clear. Primary, secondary, tertiary. Now, within that, let's revisit the public versus private distinction. Can you elaborate on the public sector first, its role and maybe strengths?
Sure. The public sector is government-funded and managed. Its main strength is providing care that's either completely free or heavily subsidized.
So affordability is key.
Absolutely crucial. It makes healthcare accessible, especially for chronic conditions that need long-term management, necessary surgeries or emergencies, particularly for people who are, cost-sensitive.
But it also faces challenges, doesn't it? We often hear about public facilities being, stretched.
Yes, that's definitely a reality. Overcrowding can be an issue. And there can be challenges with infrastructure, maybe staffing levels, particularly in more remote or rural areas. Sometimes there are also concerns raised about efficiency or resource management, even mentions of corruption in some contexts.
Right. So let's flip to the private side. What defines the private sector in India?
The private sector includes hospitals, clinics, diagnostic labs, all operating essentially on a for-profit basis. It's heavily concentrated in urban areas, much more so than the public sector.
And what are its perceived advantages?
Often you'll find better amenities, perhaps newer equipment. Service can be quicker, shorter waiting times for appointments or procedures. There's often a perception of higher quality care and generally more convenience.
But perception isn't always reality. You mentioned quality earlier.
Exactly. And the biggest factor is cost. Private healthcare is significantly more expensive. Access often hinges on having good health insurance.
So insurance becomes really important.
Very much so. And it's critical to debunk the idea that higher cost automatically means better quality. Quality can vary significantly in the private sector, too. You need to be an informed consumer.
That's a really vital point. Don't
Right.
assume price equals quality. Okay, let's think geographically now. You mentioned the urban concentration of private facilities. How stark is the difference in access between cities and rural areas?
It's quite stark, unfortunately. Urban centers usually have a multitude of options.
Yeah.
Public hospitals, private hospitals, specialist clinics, diagnostic centers, you have choice.
Whereas in rural areas,
Access is often much more limited. People might rely heavily, sometimes exclusively, on the local PHC or perhaps community health workers for their basic needs. Getting specialized care often means traveling significant distances, which brings its own challenges of cost and time. This urban-rural divide is a major, major challenge for equitable healthcare.
it really shapes the experience of healthcare for millions. Okay, let's shift gears slightly to governance and funding. How is this whole system managed and paid for? Who's in charge?
Well, constitutionally, healthcare is primarily a state subject in India.
Meaning the individual state governments are the main players.
Yes, the state and union territory governments have the primary responsibility for organizing and delivering healthcare services to their populations. They run most of the public hospitals and health centers.
So what role does the central government in Delhi play?
The central government has a very important supportive role. It formulates national health policies, provides significant financial assistance to the states, and drives major national health programs.
Like which ones?
Key examples are the National Health Mission, the NHM, which aims to strengthen state health systems overall, and the big one, Ayushman Bharat.
How does that central funding work? Just block grants?
It's a mix. The center provides funds through specific transfers, grants tied to certain programs or outcomes, trying to ensure states have resources for essential services and national priorities.
Okay. And the NHM, you said it strengthens state systems.
Yes, its goal is broad. Improve access, improve quality, reduce out-of-pocket expenses, particularly focusing on rural and vulnerable urban populations. It supports infrastructure, human resources, and service delivery improvements.
All right. And Ayushman Bharat. That one gets a lot of attention. It has two parts, right?
It does. First, there are the Health and Wellness Centers, or HWCs. The idea is to upgrade existing subcenters and PHCs to provide more comprehensive primary care, including screenings for non-communicable diseases, right in the community.
Expanding that primary care base.
Exactly. And the second very significant component is the Pradhan Mantri Jan Arogya Yojana PMJAY.
The insurance scheme.
Yes, it's a massive health insurance scheme targeting the bottom, roughly 40% of the population based on socioeconomic criteria. It provides financial protection, covering costs up to 5 lakh per family per year for secondary and tertiary care hospitalizations.
And people can use this in private hospitals, too.
Yes, in empaneled private hospitals as well as public ones. The goal is to reduce catastrophic health expenditure and improve access to higher-level care for low-income families.
That sounds like a potentially transformative program. Okay, we've covered structure, public-private, governance, funding, but we know there are still big challenges. What are the main hurdles the system faces?
There are several persistent ones. A major one is overall public spending on health. As a percentage of GDP, India's spending is still relatively low compared to many other nations, even developing ones.
Which leads to underfunding.
Yes, it often translates to under-resourced public hospitals, infrastructure gaps, and sometimes shortages of essential supplies or staff.
And we keep coming back to this urban-rural gap.
It remains a critical challenge. Healthcare facilities, specialists, even basic infrastructure are just much more concentrated in cities. Rural populations often lack adequate access.
Another issue often mentioned is people paying directly for care, out-of-pocket expenses.
Yes, that's a huge issue. A very large portion of total health spending in India comes directly from individuals' pockets when they access care.
Which can be devastating for families, right?
Absolutely. It can push families into poverty, force them to sell assets, or forego necessary treatment altogether, especially for serious or chronic conditions. Reducing this out-of-pocket burden is a major policy goal.
What about the workforce? Enough doctors and nurses.
There's a significant shortage of qualified medical personnel, doctors, nurses, technicians. And, again, the distribution is uneven, with shortages being much worse in rural and underserved areas. The doctor-to-patient ratio is below WHO recommendations for the country as a whole.
And finally, quality control and regulation. You touched on this with the private sector.
Yes, quality as care can be highly variable across both public and private sectors. And the regulation, particularly of the private sector, is still evolving and sometimes seen as inadequate. This can lead to problems like inconsistent treatment standards, unnecessary procedures, or overcharging. As we said, cost isn't a reliable indicator of quality alone.
So quite a list of challenges. Funding, access, cost burden, workforce quality. It's a complex picture.
It certainly is strengths and progress alongside significant ongoing challenges.
Now let's introduce another layer of complexity, or perhaps richness. The AWHH system. What is that?
AWEHH is an acronym. It stands for Ayurveda, Yoga and Naturopathy, Unani, Siddha, and Homeopathy. These represent the traditional and complementary systems of medicine practiced widely in India.
So these aren't just informal practices, they have government recognition.
Oh yes, very much so. There's actually a dedicated ministry of AWH established to promote research, education, and the propagation of these systems. They are officially recognized parts of the healthcare landscape.
Interesting. And what's the general philosophy behind these AWH systems?
Broadly speaking, they tend to emphasize a holistic approach. They look at the balance of the body, mind, and sometimes spirit. There's often a strong focus on prevention, maintaining health, and rejuvenation, not just curing disease.
Can you give us a quick sense of each one? Ayurveda.
Ayurveda is ancient, focusing on balancing three doshas or bodily energies, vata, pitta, kapha, using herbs, diet, lifestyle changes.
Yoga and naturopathy.
Yoga involves physical postures, breathing, meditation. Naturopathy uses natural methods like diet, hydrotherapy, herbs. They're often combined.
Unani.
Unani is based on Greek-Arabic medicine principles, focusing on balancing bodily humors using herbal remedies. Siddha is a system primarily from Tamil Nadu, using herbal and mineral preparations.
And homeopathy.
Homeopathy uses highly diluted substances derived from plants, minerals, or animals based on the principle of like cures like to stimulate the body's healing response.
Are these systems integrated at all with the mainstream, allopathic system we discussed earlier?
There are efforts towards integration. It's called co-location sometimes, where you might find an AWH clinic within or alongside a primary health center. There's growing interest in using AWH approaches, especially for chronic disease management, lifestyle disorders, and general wellness, alongside conventional medicine where appropriate. Research is ongoing into efficacy and integration models.
What are seen as the main benefits or advantages of AWH?
Well, the holistic perspective is definitely one. Many people appreciate the focus on natural remedies and potentially fewer side effects for certain conditions. Cost effectiveness is sometimes cited as an advantage too, though that varies. And there's a strong cultural connection and growing popularity, both in India and globally.
It adds another dimension to the healthcare options available. Okay, looking forward now, are there recent reforms or innovations changing the landscape?
Yes, definitely. Digital health is a big one. The Ayushman Bharat Digital Mission, or ABDM, aims to create digital health IDs for citizens and digitize health records.
To improve efficiency and continuity of care.
Exactly. Making your health history easily accessible, with consent, wherever you seek care. Telemedicine also saw a massive boost, accelerated by the pandemic. Platforms like eSanjivani allow remote consultations, improving access, especially in remote areas or for follow-ups.
And India's role in pharmaceuticals.
Oh, absolutely. India is a global powerhouse in generic drug and vaccine manufacturing, often called the pharmacy of the world. This capacity is crucial not just globally, but also for ensuring affordable medicine domestically.
So lots of moving parts, lots of evolution. As we kind of bring this together, what are the absolute key takeaways for someone trying to understand and maybe navigate this system?
I'd say remember the three tiers: primary, secondary, tertiary. Understand the public versus private dynamic, the strengths and weaknesses of each, and the cost implications. Recognize that healthcare is primarily managed at the state level, though central schemes like Ayushman Bharat are critical. And be aware of IUSH as another available stream of healthcare.
Having that basic map helps make more informed choices.
Definitely. Knowing where to start, what questions to ask, understanding the potential costs and options, it empowers you as a patient or caregiver.
And looking ahead, what's the general trajectory? More investment, more tech.
I think we'll see continued efforts to increase government spending, though the pace is always debated. The private sector will likely continue to grow and innovate. Technology, especially digital health and AI, will undoubtedly play a bigger role. And the push towards universal health coverage, addressing those challenges of access, cost, and quality, will remain the central long-term goal.
This has been incredibly helpful. really mapping out the terrain of Indian healthcare. We've covered the structure, the public-private interplay, state responsibility, the role of AYUSH, the big challenges, and the reforms underway.
It's a system with immense scale and complexity, constantly evolving.
Absolutely. And that leads to a final thought for you, our listener. Given everything we've discussed, the complexities, the progress, the challenges, what role can your own awareness, your informed choices play in navigating the system effectively for yourself and perhaps advocating for better healthcare in your community? What other questions does this deep dive spark for you about where Indian healthcare is headed?